Grafting with EthOss after removal of impacted wisdom teeth, especially the lower wisdom teeth. Now this is another controversial area because yes, it will heal, and yes, the host healing is really good in this area, especially in patients under 25. And I wouldn't really bother to advocate it then, but as patients get older, the healing may not be as effective. And the problem really here is, as you know, we will end up with exposure of the root distal to the 7. And this may lead to sensitivity in the patient. So this is the only real reason for grafting this situation and this site. Is it of a benefit? Yes. What we're noticing is dramatic improvements of the regeneration of the bone. Again, it's the scaffold nature, the bacteriostatic nature, but generally the encouragement, the osteoinductive effect of these materials leads to an improved vertical growth, therefore less exposed cementum on these roots and improved gum attachment. So the patient's always happier with that as well, because it's always a difficult thing to deal with afterwards when we have sensitivity on the lower 7. So the cases we're going to look at is a simple routine mesoangular impaction, and we're going to just by raising a flap, decoronate the crown, split the roots and remove the roots one by one. Then we need to clean the site. Now take caution with this aspect because obviously if it's close to the inferior alveolar nerve, we do not want to damage the nerve at this time. As to the effect of EthOss on the nerve, we've had a number of cases done by dentists in Europe where the graft material has totally encompassed the nerve and we've had no problem with any long-term paresthesia. So we haven't had any side effects, or no one has mentioned that from cases that I've seen from maxillofacial surgeons in countries in Europe. Once we've actually then cleaned the site, it's important to then pack with the EthOss, dry the site and suture closed. It's generally quite easy to get very good closure once you've removed the tooth. The two sections, and healing is often very good in the area. Again, I like to put a blue M gel over the top. Then you can see on this case is at 6 months and at 2 years, the really good regeneration, and especially when we probe distally to the 7. This is the important aspect, is that if you have very little probing depth at the end, this is what's going to maintain this situation and also provide a nice long-term stability in the case. Again, only the patient's own bone. We haven't left any foreign material in there. And again, this is better for the remodeling and modeling of the host bone. So the patients are a lot more comfortable post-operative, we feel, due to the biocompatible nature. It's a difficult one, as I say again, because it will heal without. So do you really need to do this? No, but again, we've got to look at the benefits, the small benefits that we can achieve.